Welcome back to News 3 Today. April is Minority Health Month, a time to bring awareness to health disparities and encourage action for those who belong to racial or ethnic minority communities. Dr. Bonzo Reddick is the director of the Coastal Health District, but today he joins us as the author of a new book called Health Equity. Thank you so much for being here today. I've been waiting for this moment since last year. You know that,
Thank
right?
you so much. It's been a long time coming. Thank you for allowing me to talk about minority health and also about my book as well.
Let's talk about why you decided to write this book. How did this all come about?
Sure. So in addition to medical school, I also went to graduate school, and my master's degree in public health had a focus on health disparities and unequal outcomes between certain groups. And so as I studied more, I realized that we really needed to rethink the way we approach healthcare in the United States. And so it just became more and more a part of my life. I started sharing it with other places, had a consulting business for a few years where I went around to hospitals and medical schools and other programs to talk about health equity. And eventually a lot of people convinced me, one of my mentors convinced me to write the book and said, you got to get this out to everybody who can't always afford to have you come out and speak to them. And so, so the book came as a result of that.
And now, these issues are top of mind right now, especially during this month, and with last week being Black Maternal Health Week. That's another, I mean, we have a lot of disparities when it comes to women and their pregnancies.
Yes, and that's coincidentally in chapter 3 of my book, but that's something that's important. And the reason that's an issue is that a lot of times people blame individual people for their health. And what the book focuses on is that, yeah, we do need to make sure we take responsibility to lead healthier lives, but a lot of the inequities that we see in healthcare systems are a result of systems. And so this book talks about how can we change our system to overcome those inequities.
Okay, so when people read the book, what are you hoping that they walk away with?
So I'm hoping they walk away with sort of a version of that, which is that we really need to focus on changing systems and not spend so much time pointing fingers. A lot of times, for example, the chapter on racism, a lot of people love to point fingers and say, is that person racist or that person racist? What we should be focusing on is on addressing systemic racism, changing systems so that individual behavior, we can overcome that. And so, and the book does it in a way that it doesn't really make you feel bad. A lot of people, there's so much debate about DEI and saying it makes people feel bad and makes people ashamed to be who they are. The book actually approaches it in somewhat a lighthearted manner. I actually give examples about how I've made the mistakes in the book, how I've judged people or stereotyped people. And so it's kind of a light way to do it, but it also focuses on there being serious outcomes when we have that kind of behavior. And we have to make these systems foolproof so that we overcome individual bad behavior.
And it also empowers the reader too, because it gives you that knowledge that you need. We were at an event not too long ago, and someone asked the question of a medical professional, do patients have better outcomes when their provider looks like them?
Sure, and I actually talked about that recently on a podcast. And so a lot of people got really intrigued by the data that when there's an increase in Black physicians in the community, that Black patients have better outcomes. But it turns out that actually when you have more diversity in the workforce, everybody has increased improvement in outcomes. So white patients, Black patients, Latino patients, everybody has improved outcomes when there's a more diverse workforce. And so that is something that's also a part of health equity as well, is making sure that we have people from all walks of life that are part of the healthcare system.
And when we look at specific illnesses, we talk about cancer and mental health. I mean, those numbers are staggering.
Absolutely. And even that's a perfect example about how the system is important, because we can talk about changing things in our society so that people have better mental health outcomes or people doing certain things for wellness. That's important, but also having an adequate number of actual providers that we have, healthcare and mental health providers. If you look at the map of Georgia from the State Office of Rural Health, they have a map about what counties in Georgia are actually health shortage counties in terms of mental health providers. And the green counties are the ones that have a shortage of mental health providers. Almost every county is green. It's a green map with a few white dots, essentially. So we need to change our system, make sure it's better access for everybody.
All right, and folks can find the book where?
So the book is available anywhere that you buy books. You also, if you want a personalized signed copy, you can buy it from my website, which is bonzobook.com, bonzobook.com, or anywhere you buy books, it's available. And you can also buy it in person this coming Sunday.
See, look, nice segue. Your book signing is Sunday, April 28th from 3 to 5 p.m. at the Beach Institute. That's at 502 East Harris Street. Thank you so much for joining us.
Thank you so much, and I'd like to give you your copy as well, a signed copy for you.
I was hoping you would do that. Thank you.
Thank you very much.
Stay with us. We'll be back with a final check of your forecast.